I'm Dr. Mini Salunkhe, Director of Obstetrics and Gynaecology at Momstory, Sahyadri Hospitals, Hadapsar. Today we are going to talk about a very common symptom in pregnancy, swelling, or as it is called in medical terms, edema. So what is this swelling in pregnancy? Where does it happen? Is it common? Is it concerning? So let's talk about all these things. Swelling usually occurs in the lower limbs, that is the feet and the ankles, and even in the calf region, usually because of many reasons. But firstly and foremost, it is because of the mechanical pressure that the pregnant uterus it is pressing on the veins below, especially the inferior vena cava, and because of this, it slows down the return of the blood from the legs to the heart. That makes the fluid pool in the lower limbs, that is the feet, ankles, and the legs. Other reasons are hormonal and vascular changes. Usually the progesterone hormone and the relaxin hormone, it makes the blood vessels relax. The walls of the blood vessels relax, because of which the fluid leaks from the walls of the blood vessels and it leads to the swelling in the tissues. Thirdly, and most commonly nowadays, most of the women that come to us in pregnancy are working women. So what happens is that lifestyle and external factors like, prolonged standing, prolonged sitting for long hours, maybe 10 to 12 hours, then more consumption of salt and other junk foods maybe. And the clothing also matters. Tight clothing for hours together or even inactivity would worsen the swelling. So what is normal swelling and which swelling is concerning? Normal swelling usually develops in most of the women because of the water retention and the reasons that I told you, especially in the last month. In the last month, this swelling which is there, it is called a physiological swelling. The swelling develops gradually. It worsens by evening because of prolonged sitting or standing, and it worsens after both the legs and when you are hanging the legs and the feet. So usually what happens that it increases in the evenings. It decreases when the pregnant patient has elevated her legs, especially overnight, and in the morning you see that the swelling in the legs has gone. Depending upon the lifestyle of the pregnant patient, usually this swelling is seen in most of the women, but in some women the water retention and the weight gain in pregnancy is more. Now, which is the swelling which is concerning and what are the warning signs and symptoms that you should be aware of before going to a doctor? So, if the swelling is of sudden onset, rapidly increasing swelling of the face, the limbs, lower limbs, then this swelling is definitely, you have to check your blood pressure and other tests and go to the doctor immediately. Sometimes the swelling is concerning when there is swelling in only one limb, one lower limb or leg or calf, in which there is pain, warmth and redness. This may be a sign of deep vein thrombosis, which is also, it may occur in pregnancy, and of course in those women who have complicated pregnancies and they have increased risk of thromboembolism. So swelling which is associated with high BP, thromboembolic episodes, some women have complicated pregnancies, then there is protein in the urine, headache, visual disturbances, upper abdominal pain. So any swelling of rapid onset with these features, definitely it is a warning sign and symptom, and you have to go to your doctor, because these may be symptoms of severe pregnancy-induced hypertension. Also in pregnancy, some women develop gestational hypothyroidism or gestational diabetes because of the increasing thyroid and the sugar levels. The swelling of the feet and the pregnancy swelling may increase. So what are the practical tips and self-care that your doctor would advise? Usually we tell the patients that when you're working for long hours, every 2 to 3 hours you take a break, remain well hydrated, decrease your salt and the junk food intake, increase the water content, take a break every 2 to 3 hours, keep walking, keep yourself well hydrated and elevate your legs whenever possible. So elevate your legs for around 20 to 30 minutes. Maybe you can elevate your legs around 30 degrees on 1 or 2 pillows. Sleep on the left side to improve circulation. Walk and stretch every 1 to 2 hours. Cut down your salt and packaged food intake. Wear comfortable shoes. Avoid tight clothing, tight leggings. Wear comfortable clothing, especially in the legs. Supposing you are in a particular profession in which you have to stand for prolonged periods of time, then you can use compression stockings to prevent the swelling from becoming worse. Monitor your blood pressure, sugar, thyroid, and urine. So, most of the swellings in pregnancy are non-concerning and they are usually seen physiologically in the last month, but they are usually harmless also. But there are certain tips which I have already given you to decrease your swelling. But please be aware of swellings which have some warning signs and symptoms and immediately report to your doctor. For more information, please visit Momstory, Sahyadri Hospitals, Hadapsar.